Hi, everyone. Welcome to this webinar. I'm your speaker today. My name is Maria Kolesnikava, campaigner, ecoactivist from Kyrgyzstan. So basically, we will be speaking today about climate change impacts on health in our region. When I say our region, I mean Caucasus, Eastern Europe, and Central. So let me briefly tell you who I am. So as I said, I'm working in Kyrgyzstan. I'm UN Earth Champion, chairwoman of Move Green NGO in Kyrgyzstan, and I'm passionate about clean air for all. So these are some of the pictures from strikes that we're been organizing in Kyrgyzstan for clean air, and also some of the valuable events, for example, like this awards for clean air campaign that we have been implementing in Kyrgyzstan and in Central Asia. So based on that, I would like us, because I cannot see you guys. I know who registered, and but really I want to start with some exercise related to our topic today. I'm not going to check on you, but let's just breathe together to start. I mean, to relax. And because like in Kyrgyzstan, for example, it's already 6 p.m. in the evening. And I know that it's also afternoon for many of you. And you have been probably working a lot today. So just relax, take your time, breathe in, breathe out. If you do some yoga, you know how to do it. Inhale and exhale, just very calmly to prepare for this session. We will approximately have with you 30 minutes of me speaking today. And then there will be a room for your questions. So let's breathe in and out. In and out. You can even close your eyes. So I hope that you relaxed a little bit. And why I started our session was this breathing exercise, because air is very important for us. So not everyone knows that person breathes in and out about 2,200 times a day, but it's more about 50,000 breathing a day. And clean air is assumed a human right, or a right to a good environment, let's say. For example, in Kyrgyzstan, it's an article devoted to this in our constitution. I know that unfortunately in Kazakhstan, it was removed recently from the constitution. But also we are, except Belarus, I guess, now we are, all of our countries in our region are members of the Aarhus Convention, and it's also the right for better environment, for a good environment, according to this international document that we are all parts of. So we just inhaled maybe, I don't know, like 10 times now, but our lungs fuel us with the oxygen, our body life-sustaining gas, right? And our lungs breathe in air, then remove the oxygen and pass it through our bloodstream, where it's carried out like to the tissues and organs that allow us to walk, talk, and move. And we don't have to learn how to do it, because when a baby borns, it's just like basic thing that he or she can do, right? And not everyone knows, unfortunately, that it's very important what we are breathing in, and that we don't have biological protection from the bad substances that can be found in the air, especially nowadays in the cities. So it's our basic need to breathe with clean air. So this is Bishkek, our capital. It's December 2022, And basically, it's the same situation today, not only in Kyrgyzstan, not only in Bishkek, but also in other countries. For example, I just checked today and Ukraine was fine, but during the day, also Belarus was fine according to international ranking on air quality. Yerevan was not very good. Like in Armenia, Yerevan was the air quality was the air pollution was high today. So this is Bishkek, and winter temperature can go down to negative 20 degrees Celsius, and coal smoke is a common story during the heating season, which is assumed to happen like from October until March. And it's the same in our region, almost everywhere. So this is the result of climate change, population growth, bad environmental management, and lack of understanding the links between environment and health. Something that you can see, and actually you can see the temperature inversion that occurs in mountainous regions like Kyrgyzstan, for example. So our country is blessed with beauty, like other countries in our region. However, we have inherited amazing mountains and also built our own out of waste in this case. So you can see the landfill in Bishkek, and I'm sure that you have landfills, and there are like landfills in our countries. So this one in particular, close to a couple of residential areas in Bishkek, and it's a capital, right? This is so-called mountains, is 22 meters high, and it burns all year round. So it's releasing methane, particulate matter 2.5, like dust particulates, and other gases. However, neither burning landfills nor coal power plants are the main air pollution sources during the heating season, as I said before. Though, like in our situations, like it can vary, right? It can vary from city to city, from country to country. But in our case, the main source of air pollution appears to be when private houses around Bishkek heat homes by burning coal, old car tires, and plastic, like everything that they can find because of the low income in our country. So open data on air quality also shows how bad air pollution is in Kyrgyzstan and in Central Asia and in Caucasus and Eastern Europe, like everywhere in the world. So my first link for you where you can find the data on air quality, real-time data, and also research based on yearly data. There are 170 countries that you can find there. And I have just checked it when I was preparing my slides for you, that all of our countries are available, the data from all of our countries and cities available on this Air Visual website, or it's called also IQ Air. So there are links, and you will get the slides after the presentation today who were registered. So if you want to use it for future publications, for example, or to some like for research. So the data is available from governmental resources, also from volunteers and citizens just who installed the sensors in their homes. For example, Purple Air Monitor or Air Visual Monitor, or in our case, we're using EECCA in Kazakhstan, in Tajikistan, in Kyrgyzstan, and also in Uzbekistan, air quality monitors. And they mostly measure particulate matter 2.5. And particulate matter 2.5 is the substance that is assumed by World Health Organization the most dangerous air pollutant that impacts air health. and this substance can like relate to the such diseases like cardiovascular diseases, heart diseases like other heart diseases, also lung diseases, and even cancer. Also, like asthma is something that is also connected with particular meta 2.5 substance in the air. However, like the data exists, and it seems not to be enough for authorities to take actions to improve the situation. Like I'm talking about Kyrgyzstan because we are the organization Move Green. We've been raising awareness on this topic for years, for 5 years now. And there is not enough actions made by our authorities on local and governmental level to improve the situation. So even though almost all countries updated their nationally determined contributions, so-called NDCs, I'm sure you're aware of these contributions. In 2021, for example, Belarus on this website, and you can see like some of the ambitious goals that our countries presented in updated documents. And like Kyrgyzstan, Belarus, Armenia, Georgia, Kazakhstan, all updated our NDCs in 2021. So you can find the relevant links. There is climate vulnerability index ranking, human development index ranking, and also like conditional emissions reduction target by 2030, mainly. And also, I want to refer here to another website, the climate and health alliance.org. And it's very interesting because I, like working on this topic, just discovered it recently. So there is Clean Air NDC scorecard. It assesses the integration of air quality considerations into NDCs of our countries. So air pollution and climate change share fossil fuel combustion, right, as a common driver. So meanwhile, climate change worsens existing air pollution, so it's a fact. These interlinkages and the impacts of poor air quality on human health demonstrate the need to embed air quality actions in NDCs. So this platform actually tried to work on these NDCs. And for example, you can see the slide I found what Georgia did, like how they evaluated Georgia NDCs, whether they really covered air pollutants or health impacts of air pollution in the NDCs. And unfortunately, you will see this when you go to this website. Unfortunately, almost nothing is done in NDCs in our countries on health impacts. For example, Georgia, Armenia, Belarus, Ukraine, and Kyrgyzstan also, we did well on just air pollutants and also some source sector, but not in health impacts. What recently happened in Kyrgyzstan, last year, UNICEF presented the data on the impact of health related to air pollution in Kyrgyzstan, and they said that 112 death cases of premature death is related or connected with air pollution in Kyrgyzstan, but this data was only connected with Bishkek residents. So 112 death cases in Bishkek in 1 year related to air pollution. So it was one of the first attempts to connect air pollution and health, to link them, and to help us advocate for clean air in our region, in our country mainly, because there are no local research done on that topic. But what our Minister of Health did, despite the fact that they were working with UNICEF team and local experts also, as well as international experts, and this research took place like 2 years, they were working on that. And just when they released the results, health ministry just denied all the figures, and they said, no, like it's not possible. There is no data available on this. We haven't conducted any research on that. So it's not true. So now, for example, there's a situation when there is international research available, but local context is that governments or local governments, they are in situation that they don't conduct this research, and they tend to ignore or, deny the facts or the figures or international research, because if they accept it right away, like it's my assumption as an activist, they will have to do something about it. But really, health impact help us to raise awareness on this topic among the general population, because only when people understand what it means for them in terms of their health, only in this case, it helps to advocate, it helps to demand clean air, better environment of the citizens. And only after that, there will be any reaction by the government, as it happened when we started our clean air campaign in 2018, just gradually. And this topic is very, it's rising, because I just returned from COP28 in Dubai. And this year, actually starting from last year, as I was informed, they were like raising interest of health and climate, because they were more and more and getting more and more research done on that topic, like health and climate, emissions and health. So it's raising topic of the interest during international negotiations, international climate negotiations. And for the first time, like ever, our Ministry of Health participated in this COP, and they were speaking in different sessions. So I was really impressed how we are starting more and more like integrating health in climate and air pollution as well. So this is another research that you can find interesting facts about NDCs and about air pollution and health in your region. Also, I was referring to IQ Air. As I said, today I checked air quality in Yerevan. It was, I think, maybe a couple of hours ago. So you can check it on Air Visual. And you can find the data from different cities, not only from one city. And all this index compiles from different cities, and then they do research. Usually, this research on air quality in the world is available in February. So what we do in our clean air campaign, for example, we use it, this rank, and also our journalists in Kyrgyzstan like use this ranking to say, like, for example, this year Kyrgyzstan in at 8th place of the worst air polluted air cities in the world, or something like this. But usually our countries are in first 20. So I really encourage you to check this platform for real-time data, how our journalists do, for example, in Kyrgyzstan. And also, like in February, there will be the whole research, the yearly research available for our countries. And of course, there are a lot of research made by different international research institutes or health organizations. And I just found the recent one, 2023 one. Climate change presents a growing threat to human health, as confirmed by the newly released global scientific report from the Lancet. And it's available in English. So climate-related health risks are not equally shared, for example, as they state. Children, the elderly, low-income communities face a greater share of risks. So you can find more And unfortunately, I didn't check if all of our countries and the region available, the data available in this research, but you can use it like to find out more of the health impact of climate change in general. So there is another great, let's say, website that you can use. It's called Climate Central. So what you can find there, so heat is one of the most studied climate hazards affecting human health and well-being, as you might know, because it's something that is related to global warming. It's well documented that high temperatures and extreme heat influence the risk of premature death and hospitalization, especially for cardiovascular and respiratory diseases, as well as other range of health outcomes. So other findings include a range of maternal, fetal, and newborn health outcomes. For example, evidence suggests an association between heat and higher rates of preterm births, low birth weight, stillbirths, neonatal stress, and overall poor child health. How it's related, you can see on this slide. So climate change, shifting rainfall, warming temperatures, wildfires, and it affects floods and droughts, violent storms, extreme heat, fire and smoke, and especially in the urban areas, we can see extreme heat impact and fire and smoke or smoke. So it's all about injury, mental illness, heat stress, insect-borne diseases, lung disease, and allergies. So it's all now all these diseases are connected or linked with climate change. So I just wanted to share some key facts and figures. Also, like climate change is directly contributing to humanitarian emergencies from heat waves, wildfires, floods, tropical storms, and hurricanes, and they are increasing in scale, frequency, and intensity. For example, research, you can see the link, the World Health Organization. The research shows that 3.6 billion people already live in areas highly susceptible to climate change. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from undernutrition, malaria, diarrhea, and heat stress alone. And also the direct damage caused to health, excluding costs in health, determining sectors such as agriculture and water and sanitation, is estimated to be between $2 and $4 billion, like US dollars per year by 2030. And of course, areas with weak health infrastructures, mostly in developing countries like ours, will be the least able to cope without assistance to prepare and respond to those risks and hazards. So reducing emissions of greenhouse gases through better transport, food, and energy use choices can result in very large gains for health, particularly through reduced air pollution. So all of this information you can find in this not the latest, but the last one, that the freshest one research done by WHO. And also, I think I'm coming to the end. And also, you can find the data, of course, in the Ministry of Health of your countries. But what we are finding difficulties in this because, first of all, there is not a willingness to share the data, despite the fact that it should be open data according to Constitution, according to Aarhus Convention. Usually we face with the problem that data does not exist, or it's not digital data. and it's hard to get this information unless you have project or research project and you involve people from ministries to work with you on that. But also besides, you can find, UNDP does a lot of research in our region, and just recent climate change impact on women's vulnerability in Georgia. It was a report was developed in 2023. There is a health section that you can use for your publications, for example. It doesn't mean that all of the research will be called climate and its health impact or something like this, but sometimes you can find health sections in different research, like this one, for example, climate change impact on women's vulnerability in Georgia. There is a link here too. So I think that also you can refer to local organizations like Move Green in Kyrgyzstan. We conduct our air quality citizen monitoring, right? And we produce seasonal reports. We also run our own campaign to advocate for clean air, to produce policy briefs based on our data, because we believe that we should present more and more data-driven solutions for our government and local governments. So you can refer to local organizations. I don't know why there is no slides. Sorry for that. On Central Asian clean air campaign. So it was maybe by mistake, or I don't know why it's not here, but be sure that it will be in my presentation. For example, there is a regional platform that we established 2 years ago. It's called EECCA, Air Quality Central Asian Platform, that unites researchers, also authorities from ministries of health, of environmental protection, from 4 countries in Central Asia: Uzbekistan, Tajikistan, Kyrgyzstan, and Kazakhstan, and also journalists. So you can become a member, for example, of this regional platform. Or even without being a member, you can still have access to latest research on air quality, on its health impact, on climate research that is done in our region. So we do have section in English, also in Russian, and there are some, very rare, unfortunately, some of the research are available in national languages. So I encourage you also to find more, to refer to regional platforms or networks, for example, Climate Action Network that I am member of, the board member of, and also there is a website, and you can find research done on climate in our countries: Caucasus, Eastern Europe, and Central Asia. So I will share these links in my final presentation. Sorry for this. And I think it's the end of my presentation for today. It's been 40 minutes. Thank you very much. So I encourage you to move green with us, even if you don't have Move Green as an organization in your countries. But let's move green with our own communities, and feel free to reach out and ask your questions. Thank you.
Thank you, Maria. I just wanted to add one thing that, so we organized it as a part of an n-ost project called In-Depth Online Journalism, and we will have not like super a lot of webinars, but still some webinars related to all our topics: health, informational society, and climate change. During the first months of 2024, it's already in 10 days. Yeah. So, and if you have any questions, yeah, we will be happy to answer them. And yeah, thank you so much, Maria, for your presentation.
Yeah, there may be some requests because, as I stated before, there is not enough data, especially in our region, on health impacts of climate, unfortunately, still, and even air pollution or even heat waves. It's and even if there are, for example, I tried to find some research in English done by local experts, like from Georgia, from Ukraine, from Belarus, from Kyrgyzstan. You have to pay for it because it's done like they're published in some international magazines or journals. So it's not really easy to access all of them.
Yeah, I think that this is the most like important perspective, and our journalists actually also ask a lot about data and how they can receive it. Yeah, but actually I also wanted to ask you, because you are a communicator in this topic, and actually like how usually journalists come to you with this kind of yeah, like issues, and how you do your campaigns in this topic. Yeah, it will be great to know more.
Yeah, thank you for a question. Well, if I start like 5 years ago, when air quality topic was not like of any interest of public, because everyone had this stereotype that we are breathing with clean air, there was no data available. And I remember we installed the first 3 air quality sensors and developed mobile application, and we prepared a press release because I'm also a journalist, like not now, but I used to work as a journalist on TV previously when I just started my career. And like we prepared the press release and we were ready to show, interesting like facts, like because it was something that we just started with, and the data was like know-how or something. And I remember just reaching out to journalists, like really to pushing them. And I remember one of the one of the most popular media in Kyrgyzstan, when I sent this press release to them and like asked if they want to, to cover this topic. We're ready. We have experts. We can show the sensors, how it works. We can show the mobile application. And they said like, sorry, environmental topics are very interesting, but we have covered one environmental topic 1 month ago already. So maybe next month we will come back to you. So that was really interesting. But I mean, throughout our and that also made us be more creative working with journalists, because we understood like, okay, journalists are busy, journalists are lazy. I mean, I'm speaking about myself when I worked as a journalist. It's not to offend anyone, but knowing the nature of the work and also like covering all topics and trying to be experts in every topic, not only environment, but also economics or like social and etc. It's not easy. So we understood, okay, we should, really work harder to make the data more attractive for journalists to cover. So what really helped these ranks, because when Bishkek is on 3rd place, 5th place, or on 1st place, and when we were we were sending this press releases or like small media releases to all journalists, inviting them, like we invited them to workshops, to press conferences, to to breakfast, to botany garden, like just to have a really nice conversation and try to also encourage them to consume the information in like relaxed way. It really helped. also organizing the events like actions or demonstrations, also very helpful. Or we did experiments with white fabric banners. We just hand the white fabric banners and put the hashtag air quality in Bishkek. And that was also something that was we got some interest in social media first, and then the journalists got interest. And I remember that they reached out to me and they asked for interviews because they thought that we shamed local government, and not only local government of Bishkek city, that they don't do enough to improve air quality in Bishkek, for example. So these kind of topics, working with data, also comparing the data with health statistics on lung diseases, for example, trying to identify the common areas. And also there is mobile application available where you can upload the data. For example, what we did last December on December, air quality data in December in Bishkek. And we discovered that this mobile application calculated how many cigarettes the person living in Bishkek would smoke, but just consumed with air. And we found out that it was 20 cigarettes. So even if you don't smoke, just living in Bishkek, just breathe in the Bishkek air in December, you smoke 20 cigarettes. So this kind of topic really helped us to raise awareness among journalists too. And that's how they started to cover this topic.
So actually we have one question, and the Gaine, okay, let's in this case give a floor to Gaine. Gaine, the floor is yours.
I think there were some questions in the chat. Maybe you want to ask that before I do my comments, because I think someone was writing.
Let's, if it's a comment, so definitely, yeah, you can go.
Okay, yeah, just because, thank you very much, Maria, for an interesting presentation. And also, yes, I come from Yerevan. So as you can see, the air was not of a very good quality. It's just, in our case, it's not directly connected to climate change. It's also due to the location of the city, because we're in a valley and we don't have winds coming and taking the air away. So it's mostly the increase of the vehicles that we have in the city that also is related to influx of over 100,000 refugees recently, because some of them, well, a lot of them have decided to come to the capital with their vehicles. But just to say that in our case, because I was involved in a national adaptation project, we did a health sector adaptation plan. And in that plan, we included the climate, it's so-called CRVA, which is climate risk and vulnerability assessment for health sector. And indeed, in our case, it was more heat than air pollution, because temperature gets crazy in Yerevan, and people with heart diseases or with any other periodic diseases or asthmas are very, very vulnerable. It is still very difficult to connect it directly, as you said, to climate change, but we have managed to work with the Ministry of Health and update their strategy, and they have included a number of measures for 2024, 2026 that are connected directly to climate change and awareness raising among the doctors and people in general. So I'm happy that we were able to have an impact in that sense. And also one of them is awareness raising, one of the measures, not only amongst the doctors, but also the wide public, and development of an early alert system, which unfortunately we don't have a very uniform one for everyone. We do have for sometimes our emergency ministry does send alerts for very, very high heat waves and stuff like that. But we need to work on that too, because these are becoming more frequent. And also, it was interesting that we worked with Yerevan municipality directly for their adaptation plan. And we worked a lot on increasing the green spaces in the city, because these contribute to decrease of pollution, amongst others, and also like help bear the heat for people. And they have included 13 actions that are aimed at increasing the green spaces. And we not only have to just plant trees, but we need to think about our water and irrigation systems, because that is another problem we have because of city growing very quickly, and the climate change exacerbating problems with water scarcity. We do have that in our city. So in our case, there is a lot of information available, and also on the ministerial website. However, probably the majority of it is in Armenian. So if anyone wants to have it in English, they can, through ERA, contact me, and I will forward, of course, whatever we have in English, because some of our experts are, English speaking or international experts, and some of the information we have is available in English as well, just to share our practices. And also, we are working on a new, we don't have a climate law. We are working on a climate law, and we are going to include further changes in the law on ambient air protection to define the greenhouse gases separately, so we can also track that in NDC. We already changed it once, but with the climate law, we're going to have a more defined one. So that is also a step towards kind of solving this problem. But it was interesting for us, because when we were working with the journalists as well, we realized that a lot of people are more paying attention to political issues, I think everywhere, but in Armenia especially. And whenever you talk about environmental issues, they kind of don't prioritize it. And we had to work and explain to our journalists that it is a security issue as much as any political discussion, because if you don't have clean water and there is a pandemic, or if you don't have adaptation in your agriculture sector and living in our region, and we can be we have issues with some of our neighbors, and we need to think about our food security as well, to be able to just have it by ourselves. So we put the emphasis on these aspects when we were communicating with journalists, and we also worked a lot with younger journalists that are still students. They actually were more flexible than already journalists that are in the field for 10, 15 years, because they have a tunnel vision on the subjects they want to cover. But the younger journalists that we had, they were amazing. We had several media contests that helped us to spark the interest towards these issues. And I'm very happy that they now continue. I see them making more and more content in this regard. So it was very interesting also to see your experience, because yes, we are maybe sometimes distracted from the climate or any other environmental subject. So that's it. And for women vulnerability also, in all our projects, we have that aspect, gender aspect, and we were able to work with our Ministry of Social Affairs. And for the first time, they have included climate-related issues in gender equality strategy. So that is going to be tackled further in the upcoming action plan, because yes, we do have gaps in data, gender disaggregated data. Some of it is available, but because it was never an issue that was tackled, yes, we do have issues with that as well. And I hope these changes will help to at least start generating this data and be able to use it further to make more concrete assessments in this domain as well. So that's it on my side. Thank you very much.
Thank you. Thank you very much for it.
Yeah, thank you, Goyene. I think that we need to like deeply look to Armenia because we're still from last webinar. We really a lot of discussed, on us about this agriculture insurance that you have related to climate change. So yeah, a lot of things to learn from Armenia. Yes, and we have a question from Aliya about understanding like how do you make it clear in your communications with the public that climate change is not equal to air pollution and vice versa. Yeah, so maybe from Kyrgyz perspective, and maybe if you have something, some points, maybe for journalists. As
you know, in our case, we started with air pollution because we didn't monitor carbon dioxide, for example. We were able to monitor particulate matter 2.5 because something that triggered me. I saw in 2016, I saw a picture from the mountains, and I couldn't covered with something gray, and I couldn't see the city of Bishkek, and I was like, "What is that?" I was just very curious, and when we didn't find any data on air quality, which was really understandable and available, I'm not even speaking about real-time data because nowadays it's available for everyone, so it's good. But recently, I found it. So we started vice versa, air pollution never was mixed with climate, or emissions, let's say, or gas emissions in our case. Because in our case, we just started, we measured particulate matter 2.5. We had to educate general public, journalists, young people, what PM 2.5. And it's interesting sometimes at our events or somewhere, when we say PM 2.5, people can say, oh, it's PM 2.5. They don't understand. They cannot say particulate matter or dust or whatever, but they know this term because PM 2.5 is something that was apparently communicated very well so far. So but now we are linking vice versa. We are saying that climate change worsens air pollution in the cities, especially with the temperature inversions, with the valleys, as Ryan also was mentioning about Yerevan, and many cities are built in the bowels, let's say, and it's just because of the temperature inversion, because of the heat waves, because of the heating of the temperature, increasing of the temperatures. So the process is now it's a lot of links or interlinks, and at the same time, people say or experts say that we shouldn't mix air pollution with emissions that impact climate change, because air pollution should be something different, and we need more finance to combat air pollution rather than climate change effects. So there is I think, ongoing discussion on that. But what I can say to conclude, we don't have this issue, but we are vice versa trying to link climate change to air pollution too. 2 years ago, we had warmer winter and air pollution was not that bad, and people were happy about climate change. They were like, oh, okay, the weather is getting warmer. We will have watermelons and nuts and clean air in watermelons grown in Bishkek soon. So I mean, it's memes or jokes, but anyway, like people start to understand the connection and links. And some of them mix them, some of them not. But I think most importantly, what government does about this and how they differ air pollution and climate, or other emissions, even like gas emissions, for example, like nitrogen dioxide, sorry, for example.
Yeah, thank you so much, Masha. Yeah, so I think that we don't have any other questions, so we can stop with this conclusion, to tell the truth. Yes, as you can see, Alia, yeah, agree with you. Yeah, so just also to say again, yeah, thank you so much, Maria. Thank you so much,
Actually, there is a question from Alia.
Yes.
Is there an understanding among people in Kyrgyzstan that these two are different things, or they're mixed?
Yeah, it was the same.
It was one
about
question.
air.
Okay.
Yes,
Yeah.
Just clarification. Yeah,
Yeah.
okay. Yeah. So again, thank you so much. Yes, and as I told, it's only our first webinar, but we are going to do more. And again, thank you so much for EECCA and for Publika, for our wonderful partners from Georgia. And yeah, we will have more webinars related to health issues. And last thing that I also shared with you, as there are a lot of journalists, our new call for grants to publish. So you can also choose a topic related to climate change and health, for example, and ask Maria. So we have also GNA perspective and think more about those issues. And yeah, so n-ost and Publika, I think we yeah wish.
Can I also
Happy New
mention?
Year, yes, yes, and Masha, yeah.
Yeah, can I also mention that really like grants and workshops for journalists and also awards really play a crucial role, because I think now for 2 years, they are more and more national awards for environmental investigations in Kyrgyzstan, for example. And I believe like it's not only our country's trend, because people are more and more, and journalists especially, more and more interested in these topics, like even if it's corruption in increasing or decreasing green spaces in the cities, for example, like more, related to local situation, for example, topics. But it's very interesting, or land use, or also water, because in our region in Central Asia, for example, we have troubles with clean water, and also like we are dependent on each other, and water is the main climate concern in our region. And there are a lot of journalists, not only in Kyrgyzstan, but also in Kazakhstan, Uzbekistan, trying to research and trying to investigate and produce the publications on these topics, for example. And because they can go to COP for these materials, for example. And we really need more and more journalists covering COPs. And I really hope that, for example, in Kyrgyzstan, we just established this goal to bring at least 2 journalists for the next COP in Azerbaijan, happening in our region next year, right? And I hope that our region will really be well presented at COP in Azerbaijan, in Baku.
Maria, not Happy New Year. Wait, we have also one more question, so let's answer if you don't mind. Don't you think that it's more important to make the governments not to close eyes on processes causing climate change and air pollution first, since it's the governments that contribute to implementation of big projects like non-justified housing building, mining, etc.?
Let me digest this question. Yeah, I do think so, but being a developing country, whenever we go to the government, to negotiations, to discussions, to conferences, like to discuss NDCs or decreasing of emissions or improving air situation in the cities, like the first answer is we don't have money. I personally don't accept this answer, because if you don't prioritize health of your citizens, why you are there in the government, right? And there is this trend or narrative that during COPs or like other investment projects, government really rely on business sector or rely on grants from international development banks. And it's everywhere, I think, in developing countries. So there is not enough money in the Republican budget, like for monitoring, for evaluation of the situation, for research, like even on this, in this sphere, rather than like to improve, like to implement the measures, even like having NDCs or other national or local plans to improve environmental situation in the cities, for example, or in the regions, or in Kyrgyzstan in general. So I think it's very important to work with governments, which we do, because without government, like we will not be able to improve the situation in any sphere. And we have a challenge with mining, for example, in Kyrgyzstan, not only in Kyrgyzstan, with nuclear power at the moment in Uzbekistan, in Kazakhstan, in Kyrgyzstan, because it's a main concern and challenge. We don't want to be dependent on Russia with Rosatom, for example. But at the same time, civil society, unfortunately, is not invited to the negotiations and discussions. We try to do what we can do. Like we also work with journalists to educate them why nuclear power is not the solution to climate change, is not the solution to air pollution, especially because we don't have capacity. We have our arguments, for example, right? We have other really great projects on solar, for example, on wind in our region, on energy efficiency that we should really work on, and our government should work on that. But unfortunately, at the moment, it's not easy to persuade government to work on awareness raising, to work on like among population, to work like with private sector, but rather than just, on their level to negotiate with Russia or to negotiate with Uzbekistan, for example, and to build nuclear power or to build the new coal plant or whatever. So it's challenging, I would say.
Yeah, thank you so much, Maria. Yeah, we even have a kind of small discussion in the comments. Yeah, but we're perfectly in time. So again, I want to say everybody, thank you so much for your participation. And again, we are looking for next opportunities next year. And Happy New Year and Christmas.
Thank you, Ira, for your moderation.
Thank you.
Thank you, Maria.
Thank you. Bye-bye.
Merry Christmas.
Bye-bye.
Happy New Year.